Hi, my name's Angeline Mitchell, and this is we're going to be going over the rehabilitation of a partial thickness rotator cuff tear in the collegiate volleyball athlete. Um, this was in chapter 22, and yeah, we're just gonna go ahead and start. So. Background on this injury. So the rotator cuff consists of the supraspinatus, infraspinatus teres minor, and subscapularis. Basically, these are all in the shoulder, and I do have some photos. So right here, so obviously this is where we get into the tear, but this is where those muscles are and tendons are located, going back. So, when a person gets a rotator cuff tear, these can either be partial or full thickness tears. Moving forward, like you can see here, this is definitely one of the fuller tears. You can see it's completely off that bone. So not a good thing to happen. And these are commonly seen in overhead athletes, or you could also just say athletes that use that over extended arm motion to either hit or to throw and use that motion of that shoulder. Or rotator cuff. So, here is a photo of a volleyball player who we're actually going to be talking about today. Um, this patient is 21-year-old female named Sabrina. She is right hand dominant, and the last 3 weeks she's been feeling an increase of pain in her shoulder during games, after practice, during practice. And it's getting worse with the hitting, serving, and also when she's sleeping as well. So we're gonna kind of go over that and where she's at and how we can help rehabilitate her and what that process looks like. Going back to these photos, this is when she's hitting. This is where we see that tear and where that injury is occurring from. Um, Moving forward, so more on the injury signs and symptoms. So, like I said, lateral shoulder pain. She's feeling pain in the night. Um, and also too, it's really reducing that mobility. And honestly, like her range of motion when she's trying to spike or serve, hit the ball. Moving forward, so we're going to go over the history, observation, palpitation, and special test that we can do to see and hopefully help Sabrina. So, history leading up to this injury, like I said, it's most of these are a gradual buildup. Um, since she has been playing for a long time. And obviously, she's been seeing this increased injury in the last 3 weeks. She is getting ready for a conference. So, obviously, with the increased practices, she is definitely in practice a lot, hitting a lot, doing all the things. And so, unfortunately, her rotator cuff and just her shoulder and those tendons are just getting stressed. So the good news is that there she doesn't feel any numbness or tingling, no prior dislocations. So she's good there. But she is feeling quite a amount of pain when she is in motion, or when she is up to serve and putting that arm um back to hit the ball. Um, But the good thing is, again, at rest, she doesn't feel that much pain, just immediately after her practices. Um, okay. So, the observation portion. So basically, this is just where we're gonna go over some of the things that we've seen. Um, so moving forward, um, so the observation, so the patient is holding their arm in the guarded position. This means that they're keeping it close to their body to avoid pain. So guarded position, so you're holding it close, or you're just coddling it. That's a really good sign of, okay, this patient is feeling some pain. Now we did only see she has like a 2 out of 10 pain. So, but this can be common, especially after when you're seeing it as an athletic trainer um, during or after practice. And then moving forward, there is mild scapular dyskinesis, which means that the shoulder blade isn't moving normally during a motion. So kind of like we talked about, she's moving, but the her shoulder and that rotator cuff is not letting her go into that full range of motion, which we're needing. She's definitely only able to hit about 70 to 120 degrees when lifting her arm out to the side, which is not the best. It's definitely very painful for her to do that, which is very common with other athletes when they do have a partial tear. For their rotator cuff. And then moving forward, there is also mild weakness in the shoulder, which suggests there is a severe structural injury, but or there isn't a severe structural injury in her shoulder, so that's good. And two, there are no signs of bruising or anything like that. So she's not in the best spot, but she thankfully is able to still move it, and we're not seeing any like dislocation or anything. Okay. Moving forward. So that was an observation. So this is the palpitation. So this is just the tenderness over so basically this is just what she's like feeling. So there's no AC joint tenderness. She's not no so basically she's okay. So she's not I mean she's not great, but this is a good sign for us to know that there isn't any severe tear where we were seeing before in this photo where you can see a huge tear in that rotator cuff. So going forward, specialty tests. So these are tests that we can do or clinical exams that we can use to help figure out where that level of motion is, where that pain is, and kind of just like where she's at. So we already did that test. So we saw here like that she's only really able to do 70 to 120 degrees without feeling the empty can test, which is but we saw that she was able to hit at 70 to 120 degrees of shoulder abduction. And basically, there's negative drop arm tests, so drop the arm, all the things. There's no um, full thickness tear, so that's great. And then we also did an MRI, and we that confirmed that there's a partial thickness tear of the spinous tendon. So this is very common to do an MRI, and um, it's very recommended that you do that because that way you can actually see. And I did have get a photo. So this is a photo of a tear. I believe this is a another thick tear. So basically hers is a little bit smaller than this. So she has a partial tear. So that's great. But that's a really great way to see if that person is has that tear, partial tear, or thick tear, or if they have a tear at all, maybe it's something different, and not the rotator cuff. So there are many treatment options. There's non-surgical and surgical. Kind of moving forward, this patient definitely, since she is a young athlete, she has a partial thickness tear, and she she still has mo movement in her arm. There's no bruising, no anything. We are able to just give her a rehab plan that is not non-surgical. But there are some surgical, tr obviously, repairs that can be made. But these are for that large or full thickness tears, persistent pain. You are constantly in pain. While when she was in rest, she only had 2 out of a 10 range of pain. So, and it would have to be significant weakness. Like she wouldn't even be able to go to practice without feeling that immense pain. So yeah, so again, non-surgical for her. She's definitely um good where she is, not in the best place again, but it could definitely be worse. Okay, so acute slash initial care. So this is her 0 to 2 weeks of basically what she was be doing, which is basically resting. She's just going to be like I have a little picture here. So she said that she had some trouble when she was sleeping, so making sure that she is sleeping correctly, making sure that she's not laying on it, and she's like how this person has some pillows propped up, and it face up. That way, she's not causing any other, movement in that muscle or in those tendons that are already pretty aggravated. And also too, we are just making sure that she is again resting and giving her that education of how to, even when she's standing or sitting, how she should be positioning her body. And then from 2 to 6 weeks, we have lots of band work. So she will be doing those exercises basically to still have that mobility, keep it up in that arm. And obviously, we're still keeping an eye on that tear, but making sure that she is doing some exercises to make sure that she's not getting rid of any of that range of motion that she had prior to that injury. We want to make sure she's fully able to extend and rotate, especially to return back to her sport, which is volleyball. And then advanced rehab, so from 6 to 8 weeks, or 6 to 10 weeks. So she'll be doing some resistance training, some close chain stability drills. So I have this person's doing like a plank, or they're getting ready to do a push-up as well. So just some of these things. Obviously, she's not going to be doing anything super intensive because like I said, she is going to be in conference and from 10 to 12 weeks. So that's kind of in this range of this time. So she will be out practicing. Um, but while she is practicing, we're just going to be monitoring. Video is really great to see if someone is having those problems reoccur again with a previous injury. So we'll just be monitoring yeah, her spike mechanics and all those things, making sure her we don't see any further signs of injury. Um, and that's also to communication as well. That's just really important. So return to sport criteria and timeline. So, basically in the next 8 to 12 weeks, if she is feeling good, the pain has significantly gone down, she's doing her exercises. I think that she'll definitely be able to return. Again, it was a partial tear. If it were a thick tear, which can happen and does happen often in college athletes, that would be something that we would have to have a longer time where some people it takes a couple of months. About like 3 to 6 months for recovery, depending on how severe. But it definitely goes person by person. And then obviously she will need her coach and her athletic trainer to clear her as well. Okay, so this is the overall understanding and conclusion of this presentation. So conclusion, so they obviously rotator cuff tears require careful clinical evaluations. So using hops and imaging to further understand the diagnosis of an injury is very important. Having those talks with your patient to make sure that we were able to figure out the best plan for her, and then also um, rehab should be progressive and specific. So this is just basically saying that um, rehab is basically so that you can get back to hopefully your sport and but also make sure that you're maintaining that range of motion and all those things that you had prior to that injury. So but this goes person to person. It is criteria based. Um it's not one size fits all. So definitely just figuring out which exercises that she feels most comfortable with is the best way to go. And these are my references. So I went through a couple of journals and some peer-reviewed websites to figure out this information. Um, and yeah, that is the end of my presentation, and I hope you enjoyed. Thank you so much. Have a good day. Bye.